Here is another polyp of the colon. You could notice that instantly. Notice that in the stalk of the colon, you could see that it is cuffed by a normal type of colonic mucosa on this side and on this side. Perhaps you could see some muscle of the muscularis mucosa, and you could certainly start to see some vessels of the submucosa as well. This is the type of polyp that's known as an adenomatous polyp. They are also called tubular adenomas almost interchangeably. These are the type that may, with time, sometimes turn into malignancies, and there's a lot of evidence for that. But the main thing for you to notice in this, as compared to our benign hyperplastic polyp, is to compare once again the normal mucosa that you see some remnants of in the stalk to the glands, which look tubular, by the way, which is why it's called a tubular adenoma, to the glands of the adenomatous polyp. Notice once again that in the normal mucosa you have an abundant mixture, in fact in this case mostly mucus type cells, although there are probably some absorptive type cells as well. Up here it's primarily goblet cells. Here's an absorptive cell, however, and here's a couple here. But often, although there may be some mixtures of mucinous cells with non-mucinous cells, notice that for the most part there is a paucity of heterogeneity of cell types. Notice that frequently in the tubular adenomas or adenomatous polyps you have basically one type of cell. Also notice that the nuclei are not characteristically oriented with their towards the basal lamina of the gland. Notice how they're kind of out at both ends. Also notice how it's not hard to find mitotic figures like you see there and there and there. So this tissue is turning over and growing faster than the normal colonic mucosa, which is probably why it's a tumor. Also notice, I hope, is that the overall staining properties of these nuclei are a little bit darker and a little bit more irregular than you see, for example, in the nuclei of the normal mucosa, which are nicely here right at the base and very nicely delineated from the underlying muscularis mucosa. Thank you very much. I think this demonstrates a tubular adenoma or adenomatous polyp very nicely.